This is a presentation for APN 610 Research Methods for the Applied Nutrition Program at UNE. My name is Justin Gaddy, and the topic of research is, can low back pain be alleviated with proper nutrition? I'm going to propose an anti-inflammatory dietary intervention to manage chronic low back pain in patients. So the area of research I'm interested in is the problem of low back pain. The incidence is high. More than a quarter of adults reported experiencing low back pain during the past 3 months. It's a very common job-related injury contributing to a lot of missed days at work. About 20% of people affected by acute low back pain develop chronic low back pain with persistent symptoms at least once a year. About 80% of adults experience low back pain at some point in their lives. Chronic back pain is defined as, which is what I'm researching, pain that persists for 12 weeks or longer, even after an initial injury or underlying cause of acute low back pain has been has been treated. The most common treatments right now, are over-the-counter NSAIDs, but it's been commonly found that patients with low back pain, or LBP, also have chronic inflammation. So they do turn to NSAIDs, which are non-steroidal anti-inflammatory drugs, to help this inflammation and pain. These NSAIDs are moderately effective in relieving pain, but they're associated with significant side effects. And so that's why people want to get away from them, and I'm proposing a different solution. So the research question I propose is, if low back pain is caused by inflammation, could eating an anti-inflammatory diet reduce the pain? Low back pain has been correlated with the inflammatory process, as research has shown. Eating an anti-inflammatory diet based on that can help reverse chronic low back pain. And if an AI anti-inflammatory diet is adopted in low back pain patients, will it alleviate low back pain, as we will measure? So the link between nutrition and inflammation, and how nutrition can help lower inflammation and thus pain. Food and nutrition are foundational tools in the treatment of painful inflammatory conditions. This has been found, and there is compelling evidence showing many benefits of a healthy diet composed mainly of unprocessed plant-based foods. Really, each condition or disease can affect pain, but inflammation itself can affect the experience of pain, which is different in each person. Tick and colleagues' research found that the common denominator of many chronic conditions is inflammation. So the anti-inflammatory diet that I'm proposing is one that's been commonly studied and researched. So it includes meat, fish, and chicken. The portions should essentially remain the same. Next, the vegetable and fruit intake should be increased substantially and replace refined sugars and flour products. And then additional calories can come from sweet potatoes, other tubers, and raw or dry roasted nuts. A good example of this is the Mediterranean diet, that is, or style diet, that's been shown to reduce cardiovascular disease factors and achieve 100% resolution of metabolic syndrome, which is also linked to inflammation. My data collection and sampling would ideally be based on a recruitment and sampling strategy and a medical care provider in a limited geographic area. So, for example, Boston, and the Partners Healthcare system in Boston will be working with a lot of low back pain patients going into physical therapy, talking with physical therapists and physiatrists on those issues. So it would be nice to start with an ideal sample from that. The inclusion criteria is in general 18 to 65 years, the presence of self-reported low back pain for more than 12 weeks, and reported on the oswestry, which we'll get to, measurement of back pain. The participants will be randomly chosen to take part in the survey, and I'll be using the G-Power calculator. A t-test will be used to determine an appropriate sample size for the study. So the methods and analysis of how to measure back pain has been highly studied, and really the gold standard is this. It's the ODI, or the Oswestry Disability Index, also known as Oswestry Low Back Pain Disability Questionnaire, will be used. They found that this is an important tool that researchers and disability evaluators used to measure a patient's permanent functional disability or ability. And like I said, the test is considered the gold standard of low back functional outcome tools. I'll be using the validated questionnaire, which is ideal to use a match pairs dependent t-test for use with validated anti-inflammatory intervention with nutrition. So pre-intervention ODI score versus the post-intervention ODI score to determine if an AI intervention was statistically significant. And they are measured very well, as for example. And the importance of this research, well, there's a gap in it. And if certain types of low back pain can be linked to dietary injury, of chronic silent inflammation, really, then why couldn't a nutritional intervention address the problem on a long-term basis, resulting in less pain and higher functioning on this ODI scale as ranked? So we're not necessarily covering up the signs and symptoms of low back pain, or immediately having complications of NSAIDs, surgery, injections, etc. And this could be a highly important research area. And here are the references I mentioned in the information session. And thank you for your time.